Hi, I'm Dr. Mark Trolice, Director of Fertility Care, the IVF Center. And today I'd like to talk with you all about Polycystic Ovarian Syndrome, or PCOS. This is the most common hormonal problem in women during their reproductive years. It actually affects 5 to 10% of all women in the reproductive age. And it's a hormone imbalance. We don't exactly know why this occurs, but the signals from the brain to the ovary are not in normal synchrony. As a result, the ovary starts producing a little bit of too much male hormone or testosterone, and that results in the unwanted hair growth in male pattern or sex pattern distribution, as well as inhibiting ovulation. Now, the diagnosis is often confusing for many people, even healthcare professionals, but it's actually very simple because it needs to meet 2 out of 3 criteria in the latest consensus conference by experts. The criteria involve ovulation dysfunction, some measure of increasing male hormone, and ultrasound. Now we'll go through them one at a time, and you actually need 2 out of 3 of those criteria. Any 2 out of those 3 make the diagnosis of polycystic ovarian syndrome. So ovulation dysfunction is when the menstrual interval from the one period to the next is irregular. Now that could mean having cycles that are 28 days to 30 days apart one month and then 21 days the next month. Or it could be having bleeding continuously or actually never having a period. It's important to realize that even if you have monthly cycles, it doesn't mean that you're ovulating, so that needs to be checked. Usually patients have menstrual intervals more than 35 days. So that would be one criteria. The next would involve some measure of increasing male hormone or testosterone, and that can be determined by having male pattern distribution of hair in the upper lip, chin, sideburns, neck, around the breasts, lower belly, lower back, and upper inner thigh, or if your total testosterone is elevated. And the last would be ultrasound appearance of the ovaries. Now, this is determined by the ovarian volume and or the number of small little cysts on the ovary that represent microscopic eggs. And if that number is above 12 on either ovary, or if the volume is more than 10 centimeters cubic square, that is going to be a higher chance of that patient having polycystic ovary. And if she meets 2 out of those 3 criteria, then the diagnosis is made. Now the treatment is really based on whether or not the woman wants to conceive. If she doesn't want to conceive, typically the birth control pill will regulate her cycle as well as help with that unwanted hair. But if she wants to conceive, there are essentially 3 options. One of them is ovulation induction, and if that's not successful, another one would be surgery called laparoscopic ovarian drilling, and the third would be in vitro fertilization. Now, fertility medication is used to really trick the brain and overcome the resistance to ovulation. And tablets are effective about 70 to 80% of the time to ovulate. And once a patient does ovulate, about 50 to 70% of patients will have conceived within 4 to 6 cycles at the most. You can increase the doses of the fertility medication, typically clomiphene citrate. And if the patient still hasn't gotten pregnant or doesn't ovulate, then surgery is an option where you can actually drill holes in the ovary with electrocautery that seems to drain the cysts and reduce male hormone and improving ovulation function. Lastly, in vitro fertilization is a very, very popular and effective method at getting a woman to ovulate and also to conceive. Now, we can't neglect the medical consequences of polycystic ovarian syndrome. We know reproductively they have trouble conceiving because of abnormal bleeding and lack of ovulation, but they also may increase the risk of miscarriage, although that's controversial, as well as increasing the risk of diabetes in pregnancy. Now, medically, they have high risks of prediabetes, so we recommend a 2-hour glucose tolerance test to screen for that. They also have higher risks of weight gain. 30% are thin, but 60 to 70% are overweight. They also have the hair growth, elevations in blood pressure, cholesterol, and triglycerides, as well as risk of precancerous buildup of the lining of the uterus because they don't ovulate and they're not producing progesterone to protect that lining. So, polycystic ovarian syndrome, very common hormonal imbalance, has medical risks as well as reproductive, and fortunately there are treatments available to help women conceive. We look forward to seeing you again in our next online webinar.